Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Together. Good morning, Dr. Mencia. This has been very busy.
Yes. That was a very interesting interview,
right?
In the half hour prior.
Well, it's what you believe in so much.
Absolutely,
and,
yeah.
it's you tell your patients, because most doctors would not even say, by the way, do you have someone at home to take care of you?
Exactly. And it's the it's the social component of healthcare that we usually take for granted, or we just tend to neglect. And in geriatric medicine, it just takes the forefront. So that was very, very interesting. I like that.
And I know that you brought Dr. Michael DeFranco, who is an orthopedic surgeon here and it's wonderful, especially Dr. DeFranco. My husband he's had 4 hip replacements, and he has 2 knee replacements. He's had his knee replacements for 25 years.
Wow, that's great.
And he's great. So a good orthopedic surgeon really can make you have a long life.
That's true. Those joint replacements can really change a person's life, really reduce the amount of pain and make them more active, and which is essential to keeping them healthy.
And things have changed. Now, you're young, but I would think if I were talking to a 75-year-old orthopedic surgeon, what he went through, for you now to have this easier time is a lot, isn't it?
It is, definitely. For hip and knee replacements, 10, 20 years ago or more, the experience was dramatically different. We know a lot more now about being able to get those patients out of the hospital earlier. They don't spend as much time in the hospital. So at a lot of centers across the country, some of those patients may be leaving the same day. Most of them, if not all of them, are walking the same day after their joint replacement. And we know a lot more now about better pain control. So we're able to make them more comfortable after their surgery.
And the software have changed a lot.
It has. The technology has really improved to the point that they're using intraoperatively the technology, computer-assisted navigation, to make bone cuts better, to help the longevity of these replacements really improve over a long time.
When I met you, Dr. DeFranco, I was so happy because it's such a struggle. As a geriatrician, you get patients that, knee and hip, that's easy to get. There are 1 a dozen out there that you can find good doctors that can do knee and hip. But Dr. DeFranco, with his specialty in sport medicine, he can do shoulder surgery. And, there are not too many people that can do shoulder surgery, and do a lot of them.
I have no idea what shoulder surgery must even be about.
There you go. We were talking about
shoulder.
that.
I don't even know what my shoulder looks like inside.
It's a joint that people tend to neglect because you don't need your shoulder to walk. And if your shoulder, some people get frozen shoulder, for example. And as long as you can walk, they feel they are okay. But your hands are so important. It's like being paralyzed. Except that, no, you are not paralyzed. You can shake hand, but you cannot bring your hand above it to fix your hair or grab a can that is above your shoulder. So shoulders are extremely important for quality of life. They are not essential for you to walk, although they are used for the upper extremity. But let's talk about shoulder surgery and the myth. Why the myth with shoulder?
Well, the shoulder joint on very basic terms is like a ball in a cup. The medical terms we use is the ball part is called the humeral head, and the cup side is called the glenoid. In every joint, the shoulder, just like the hip and the knee, those bones inside the joint, those bones are covered with what we call cartilage. Over time, that cartilage can wear away, and that process is what we call arthritis. That's one of the most common problems that we see in the shoulder joint, in addition to problems with the muscles that surround the shoulder joint that allow you to move your arms in space, to fix your hair, or to extend your arm to shake somebody's hand or to give somebody a hug. Again, like Dr. Mencia said, you don't walk on your arms, but you need them. They're essential to functions of daily living. So the muscles that allow you to do a lot of those activities are called the rotator cuff muscles. And that's one of the most common problems that we see in the shoulder as well.
So, Dr. DeFranco, so let's look at this. I could move around, do everything. Now, what could happen that I can't do that? What would cause that?
Well, there's a spectrum of disorders that happen in the rotator cuff. If you just overstretch the muscles, that's what we call a muscle strain. The second thing that can happen is that a tendinitis can develop, so inflammation around the muscles. And then more severe condition would be tear of the rotator cuff, which can either be partial or it can be complete. And when the rotator cuff muscle starts to tear off of the bone, off of its attachment site on the bone inside the shoulder joint, then the arm becomes painful and it becomes weak and it starts to limit function. And that's typically when we see patients seeking help from an orthopedic surgeon.
It doesn't take a lot. It's interesting. I had a patient that went with a friend of his that was visiting, so they went to the gym. So he's trying to show up with his friend and try to do a little bit extra weight with his arm. And he couldn't move the arm. And he said, I've been suffering now for 3 or 4 months. I cannot move my arm. So we tried to go back to see what happened to him. Did you had a fall, anything like that? He said, no, the only thing I recall is going to the gym, and then I started lifting more weight than normal. Instead of doing dumbbell with the low weight, he was doing heavy dumbbell like, Charles Atlas, and he hurt himself. So it could be something simple as doing the wrong exercise with multiple repetition can produce significant damage.
That's a very common problem that we see is people who are very interested in being active, going to the gym and working out. They may go there, they might not have very good instruction. So I just like to stress that that's very important. If you want to go to the gym and lift weights, to get some instruction, start, as Dr. Mencia has said, with a low weight or a low number of reps, and over a period of several weeks or months, build it up. Just don't go to the gym and try to compete with your friend who's always already at a 100-pound or 300-pound weightlifting level.
Right.
Well, we always tell the older adults when you're sitting watching television, get a can in each hand and just take the can and make your arms go up. You know about
simple.
that. It's very simple. And, you can only, after 20 times, you really have exercised yourself, but it's not very, it's not damaging, is it?
Right. Yeah, and you don't need a lot of weight to stay in good shape. If you have a combination of a low weight exercise program and then some cardio exercise you do, that can keep you very healthy.
Now, I know you were a professor at Harvard, so, your credentials are amazing. We can spend the whole time just talking about your credentials.
His credentials are superb.
And you have worked with some of the professional
And he's attractive, too. You didn't say that.
Everybody that come here, they're
That's
attractive.
Right. We demand that, right? Sorry. Always have to add
I was fortunate to have, as part of my training, specialty training in shoulder surgery at Massachusetts General Hospital in Boston, and I spent part of that year in Europe studying under the shoulder specialists over there. So that's been a very significant and important part of my training.
And you have worked with some of the professional sport team.
Yes, as part of my sport, I did a 1-year fellowship, which is a 1-year training in shoulder surgery, and then another one in sports medicine. And during that year in Chicago, I was part of helping with the Chicago Bulls and the Chicago White Sox. Being from Cleveland, that was difficult because I'm a Cleveland Cavs fan, and I always had to go and cover the Chicago Bulls team. So.
But now we know that there are some thinking about sports-related injuries. The kids, what's happening with football and what's going on with them. Do you see children also?
Yes, I do. And in the sports world, in the athletic world, that age group, what we've seen over the past couple of years, and there's been a very big emphasis among sports medicine doctors to address this problem, is that we're seeing more of what we call overuse injuries. Is that these kids are just overusing their bodies. That again, they have good intention, they want to play sports, but they're not taking a break. So they may go from the summer into the fall season to the spring season, and or the winter season and then the spring season, and they're not taking a break, or they're competing on several teams, whether it be their high school team or a traveling team, and they're just, it's too much. It gets to be too much for their body. So very commonly they get conditions like muscle strain and tendinitis, and some of them get irritation around their growth plates. And we've seen a dramatic rise in these injuries, and trying to address these issues, as orthopedic surgeons have done, just to provide better education to the parents and to the young athletes.
I just sent a patient to Dr. DeFranco this week, and she played golf. So she has a sciatica, very active lady, and she's suffering a lot. So I put one of those flexor patch, and I say, I want you to go and see Dr. DeFranco. And he said, well, he's an orthopedic sport medicine. oh, no, I don't want surgery. I say, I don't want you to go for surgery. If this guy can take the Michael Jordan out there and put them back to play, he can take you out there and treat you and get you back out there. Because what people don't understand, and you can elaborate a little bit on this, people don't understand that you can have an acute problem and it's so easy to treat without surgery. But if you let it be for a long time, now it becomes a chronic inflammation, and that's much harder to treat.
Yes, it is.
It's a good point.
Yes, that's a thing that we see in the kids as well, is that when they start to get overload their body, or the muscles start to get sore, then then their muscles start to get weaker, and their joints are not as protected. So somebody who may have a minor injury, as Dr. Mencia described, if they continue to try to play through that, and they're putting a lot of stress on their body in the area that's injured, that can ultimately turn into a very difficult problem or a surgical problem. So you could turn something that could be treated without surgery into something that needs surgery. And just another point to follow up on is that people do hear the words orthopedic surgeon, and they think that our job is just to operate. But actually, a lot of what we do is non-operative. And for myself and my practice, I always tell patients, even though I'm a surgeon and I like to operate, we're going to do everything we can to improve your condition and get you better and get you back to where you want to be in life without doing surgery. If we have to do it, we'll do it. But we try the non-operative options first.
Well, we're so happy we have you here in South Florida. We have so many people that play tennis and play golf. People that move to South Florida, they want to remain active. So we're going to give you
Yes, we're going to tell you. Now, you're listening, of course, to Dr. Andy Mencia, and his guest he brought on, of course, is Dr. Michael DeFranco, who is an orthopedic surgeon. But what we want to do is to give you the phone number for Dr. Mencia's office, which is 954-489-1345. Again, that's 954-489-1345. And they also have, of course, a beautiful office in Boynton Beach now. But if you call the other number, I'm not going to give you a lot of numbers, so that you can just put this down for Pencil Talk Radio, write down 954-489-1345, and then put down the website agifl.com, and you'll be able to see their website and everything they're doing. Also, you do know that Dr. Mencia does have home visits, very, very important, especially if you have orthopedic surgery done. You may need some home visits. Let me give if you're interested in calling Dr. DeFranco directly, you can call him at 954-771-3334. That's 954-771-3334. And remember, something that was just been said here is very important. Although Dr. DeFranco is an orthopedic surgeon, there are many things that can be done without surgery, but you have to go to someone who understands that. And with your credentials, that's what you do.
Exactly.
Dr. Mencia, I wanted to pick up on what Dr. DeFranco said before. He actually said you could have knee surgery, hip surgery, and be walking the next day and go home the next day. You've been practicing medicine for a long time. Isn't that unheard of?
That is unheard of. That's relatively new with all the technique. The surgical technique have changed so much. The software have changed so much. And even Dr. DeFranco, with his training, he's one of the type of person we want to have on the Cure Symposium, because one of the technique that he does is what's called reverse shoulder surgery. And why don't we talk about reverse shoulder surgery? Because a lot of people, when they need shoulder surgery, they think that the only thing out there is the traditional shoulder surgery. Let's talk about reverse shoulder surgery.
I've never heard of that. Please.
Just to clarify, the shoulder replacement surgery is typically for somebody who has arthritis in their shoulder. And so a traditional shoulder replacement would be when a surgeon goes into your shoulder joint and they cut out the arthritis and they replace the ball side with a metal ball, and the cup side they implant a plastic cup. In order for that to work correctly, you need a functioning rotator cuff. But in a lot of older people, when they develop, they can have a combination of arthritis in their shoulder and a rotator cuff tear. And under that condition, if the rotator cuff is torn and not working well, then the traditional shoulder replacement, if it was implanted in a person with the combination of those two problems, would fail ultimately because the rotator cuff isn't working correctly. So the other prosthesis that we use in somebody with the combination of arthritis and a rotator cuff tear is what's called a reverse shoulder. And it's called a reverse shoulder or reverse shoulder replacement because we reverse the components. Instead of replacing the ball with a ball and a cup with a cup, we put the ball on the cup side and the cup on the ball side. And that allows a person, with the mechanics of the joint being changed like that, it allows a person to raise their arm to shoulder or above using their deltoid muscle instead of the rotator cuff muscles.
So the ball is on the shoulder blade
Yes.
side,
Yes.
and the cup is on the arm side.
Correct.
That's very interesting. And
Yeah.
that's
Oh,
cutting
yes,
edge.
I have never heard of that, and I don't know too many people with shoulder problems. Stuff I guess I don't
I know a
ask.
lot of
Yeah.
patients,
You must, but
and with traditional shoulder surgery, one of the problems if they have a problem with the muscle that control the shoulder, it's a lot of muscle that control the movement of the arm. And if you have problem with those muscles, the supporting muscle, the shoulder surgery looks like to the patient like it was not successful. But it was not the shoulder surgery per se, it's just the fact that you have a tear in there that will not allow you to recuperate.
Does
back to
Dr. DeFranco know that you're a Taekwondo master of the very highest?
I
Did
don't
you
know.
know that?
I did not know that, but
you can-
that sounds like a potential shoulder patient.
No, he is. I mean,
Yeah,
he
I'm a
knows,
grandmaster in Taekwondo.
Yeah,
so yes.
Taekwondo. So I mean,
Might be calling him for lessons then.
we always say, "Will you start a class? We all want to do this, so we can look like him and be
I
like
think
him."
I wrote a book on injuries in Taekwondo.
How come I've never seen that book?
I had to pull it out of the.
Yeah, but I thought I knew everything about you. All these
now
secrets.
that I know Dr. DeFranco, I think we had to rewrite the book.
Yeah,
Oh, it's like-
sounds like a
right.
good project. Yeah.
But so let's go to exercise. What would you tell your patients to do for exercise as they're aging? Let's look at a 70-year-old person.
Yes.
What kind of exercise do you think that person should do so that they can keep their muscles and their everything strong so they don't have to see you? Sorry.
No, that's important. I don't take it personally. People always say that in my office when after they've recovered from their problem, they're leaving. They say,
I'll
"I
never
hope
see you
I
again."
hope I never see you again." Yeah, so, okay, I won't take it personally. That's good. I think the first step when you talk to people about exercise is communicating with them and their primary care doctor about their medical problems and any medications that they're on to ensure that whatever you recommend to them is safe for them. Because again, we can all overdo it. If we have certain medical problems, there may not be exercises that are good for you to do. So just as a general first step, that would be a conversation I would have for the patient. And then we look at what they enjoy doing, because I think if you try to prescribe an exercise regimen to somebody and they're completely not interested in it, the likelihood of them doing it is very low. So you talk to them about, what do you like to do? Do you have friends that like to go for walks or ride bike or go to the pool, and get a sense of what they might enjoy doing. And once you have those two factors on the table, then you can start to kind of implement and or basically put together an exercise program for them. And the typical things I tell them is to have a combination, if they like it, is a lightweight program, even if it's with soup cans, as you described before, because that's very easy and something they could do in their house or with their friends rather than having to go sign up for a gym membership. But the other things would be simple. Walking. If people like to jog, I'm not opposed to that. It's a little bit more stress on the joints, especially when people have an arthritic knee, hip, or lower back. So I'm not a big proponent of people running every day, but if they like a gentle jog a couple times a week, that's okay. But the important point for those people is to mix it up. Go for a walk or an exercise bike, whether it be a stationary bike or a bike out on the road, or a recumbent bike is very good. We're seeing a rise in the
Those
use
are the
of
ones where
recumbent
people
bike.
are lying down and they're
lying down or
biking.
sitting, and it's again.
What
it's
is the advantage? I don't really have not understood that.
Well, some people, it's very difficult if they're on a traditional cycling bike or even a mountain bike. Being in that position can put some stress on the lower back or on their neck, and that might be very uncomfortable for them. So when they're in a sitting position or a more recumbent position, it takes stress off of those areas of their body and allows them just to focus on pedaling and getting the exercise in their legs that they need.
And it takes some of the stress off from the lower extremity joint also.
Yes.
So.
Yes.
But how about swimming? I mean,
Swimming
you
is-
mentioned this. So
Yes.
is
Fantastic
that a good
is
thing?
swimming, yes. And some people don't like to get in the pool because they think, I don't know how to swim.
Or I don't
know
look
if
good.
Right, right. That's always an issue. But again, you don't have to. You can go in a pool with your shorts and a t-shirt on. So you don't necessarily have to be in a bathing suit. But and you don't necessarily have to swim. Just walking in the water, getting the resistance against your legs, or trying to do a fast-paced walk in shallow water is very good exercise. That's a good way you can get your heart up. You can exercise your muscles, and most importantly, for arthritic joints, the buoyancy of the water takes stress off of the ankle, off of the knee, off of the hip. So it's a very good way to get exercise and to take stress off of the joints that you might experience if you were out running or walking on hard pavement.
Frozen shoulder. Why people get frozen shoulder?
Well,
besides going into the refrigerator, I don't know.
Yeah, right.
Too many walks in the refrigerator, frozen shoulder. That's good.
Too many beers.
Yeah. Well, I came from Chicago, and I had frozen shoulder a couple of times over this past winter.
I'm sure.
But frozen shoulder is a very complex problem that we see in the shoulder joint, and people can get that for a number of reasons. They may be doing something in their house. They may overstretch their arm, reaching to put something on a shelf. Some people may fall and their shoulder gets irritated. Generally, what happens is that the piece of tissue that surrounds the shoulder joint, the ball and the cup that we've been talking about, that can get irritated. And when it gets irritated, it can shrink. And when it shrinks around the ball and the cup, then there's less movement for people to move their arm. So what the general treatment for that, and 98% of the time it is successful, is to get the patient on a stretching program, for them to stretch at home 3 times a day and get them in the hands of a knowledgeable physical therapist who can stretch their shoulder well too. And over time, it will start to loosen up, but it's something that you need to be patient with. It's not something that goes away in a day or two. It takes typically several weeks or several months.
I'm glad you're mentioning that, because there is another profession, physiatrists. And can you explain that to people, of what the difference in a physical therapist and a physiatrist is, please?
Well, I think their training is a little bit different. The physical therapists are there. They are basically there to help the person go through rehabilitation. They have a lot of modalities that they do in terms of reducing pain and inflammation, to help improve range of motion, and then to help build strength and condition the muscles and the joints that are of issue. Physiatrists are doctors who may do more of the same, but are more. They can be better at diagnosing specific problems, and they have a better ability to provide certain treatments that may help control pain that the physical therapists don't have. Dr. Mencia you may have somebody in your office who actually does physiatry. I'm not sure, but
I work with some of the physiatrists.
Because they're unusual. That's not a common. People can't even say the word. It's a little different. But I was just curious about it. Well, I want to make sure that everybody has the phone number again for Dr. Mencia. He is there on Saturdays. He's running off to go there and take care of his patients in his gorgeous tie and his suit and. How come you're not in Esquire magazine?
I'm waiting for you.
I'm waiting. I've got to do this for you. I have to do this. When you see the cover of our magazine, we featured the love couple of 50 Shades of Grey. You're going to really love that one.
Oh, I'm there?
Yeah. Sorry, I didn't even bring that up. I have a big old series of articles on this.
Take his face off and then put mine.
Yeah, right. Okay, well, we'll think about that. 954. Oh, my goodness. 954-489-1345. That's 954-489-1345. And if you want to talk to Dr. DeFranco, you would call him and his for an appointment at 954-771-0498. And they would just, now, that's the occupational physician. That's not the right number. The number for the appointment is 954-771-3334. That's the number, really, to make an appointment with you. I just have to say, you've done it again, Dr. Mencia. You do bring very, very interesting guests for us, and it gives a diversity, but that's really what you're all about, the diversity of medicine. And we have just run out of time, so you can't even answer. But we'll be back. Just stay listening.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.